I like this guy a lot. He's a really, really great individual from, from Cuba originally, Puerto Rico. He made a pit stop there. From Puerto Rico as well. So we definitely have roots there. Monster corn. I feel his discomfort. Good news and great news. The good news will go ahead and enucleate this seated porokeratotic lesion. This is like a boulder. And now I'm gonna come like this. Perdona, people.
No problema.
Watch this. He's gonna come out of here. He's gonna leave this office with the biggest smile ever. Because he's never had this done. When we talk about transformations, this is what I'm talking about. Now, oh yeah. Phenomenal. Okay, let's go to the whitey board. Everyone, if you don't want to be on camera, thank you very much. Here we go. No one likes to be in front of the camera. No one does. Simple. Here we go. Ready? We're gonna make this a quickie. People like the quickies. Toe, metatarsal side, okay? We did this historically. We see these monster corns on the bottom of the metatarsals. And what we historically do, we just had a patient recently where we basically went in there, right? Had this huge corn / callus. And what we basically, it was about 2 weeks ago, and what we did was we removed, right? We performed a minimally invasive excision of the bone spur, which is at the core of the problem. And once we did that, the patient was super duper happy because this went away. So again, if you remove at the core of the problem, no pun intended there, if you remove this, this goes away. Now, I'm going to present to you guys, this is a little bit more of an atypical case. We've done a couple of these cases, okay? Kind of like that. Actually, I don't like that. One second. Fifth metatarsal. We have the base. Head, shaft, base. At the base, underneath here, the patient has a bone spur. We'll say it's right here. Not only does he have a bone spur, he's got a lack of fat pad. And as we've spoken about in the past, fat plays a major role in accommodation. So not only does he has a bone spur, he has fat pad atrophy. So it's sort of like the trifecta, right? He's got the corn, he's got this, he's got the lack of fat pad, and that's where you see this huge corn, which is extremely painful. So this is an easy fix, just like I was telling you guys about the other case. What we basically do is percutaneously, we make a tiny little incision, one little stitch. We basically just shave down all of this area here. Okay, kind of like that. I'm just exaggerating a little bit. This is the skin. So once you remove the bone spur, this goes away. So then this becomes that. Okay? So, and in addition to that, once we do that, we're going to send the patient for a medical clearance, make sure, you know, even though this is like a lunchtime thing, right? It's always really important to send all of our patients to get medical clearance. It is the standard of care at the end of the day. After the procedure, we're going to go ahead and cast and fabricate these great custom molded orthotics that will also help him. You know, my job is to get him comfortable, for him to enjoy more than anything his life. Quality of life is extremely important, and that's the goal here. Elimination of pain, quality of life. Questions?
Once you remove the core of the problem, that
Yes.
piece of bone or whatever it is, will it grow back?
Excellent question. Excellent question by the daughter. Dr. Wagner, once you remove that bone spur, will the bone spur come back? There are sometimes some cases where bone tends to regenerate. Okay, that's why we do take a little bit more bone than the usual, just in case. Okay, but that's a great question. How can we prevent that? We really can't. You can't take too much bone off either, right? So we don't want to alter, you know, biomechanics, structure. Not only that, there's a very important tendon that attaches there. And it plays a very integral role in biomechanics of the foot. So it's, but that's a great question. That's a fantastic question, actually. Like always, www.jawspodiatry.com, Instagram, Dr. Toe Jam, Jaws Podiatry, Facebook, and last but not least, our YouTube channel, Jaws Healthcare. I will